Hello, I'm Dr. Dawn Harper and I'm here with Spatial Wellbeing. Today I thought we ought to talk about mental health, and I am very mindful that we are living in very unusual times, which I know is causing a lot of anxiety for a lot of people, and a lot of people struggling with their mental health. It's something in general practice that we are very mindful of. We know that there will be a lot of mental ill health being stored up, and whilst everybody was amazing at not bothering us at the start of this pandemic, we want to be bothered. We want to hear from you if you're struggling. And I think there will be a number of different reasons why people are struggling. Health anxiety, of course, is going to be very high up there. Sadly, far too many families have lost loved ones, and bereavement is tricky at the best of times, but having to go through a funeral in current times is a very unusual and very different experience, and I know a lot of people will be struggling with bereavement, and a lot of people frightened about their own health. So I think try to be positive if you can. Think about the positive things that you can do. We've been told in England at least that we can exercise more than once a day now, and if you can get out and get exercising, I really would encourage you. I know if you're at home very worried or feeling very down and lacking motivation, then perhaps getting out and getting some exercise is perhaps not top of your agenda. But whenever I talk to my patients, if I can persuade them, even if it's just a walk out near nature, if possible, actually, if they can do that regularly, I do notice that people feel more energized and feel more positive. So we know that we can go out and about, so let's do that. Let's really try and make the most of exercise in whatever form you want. It is really good for your mental health. Whilst we're talking about health anxieties as well, I would limit the amount of time you listen to the news. There's rolling 24-hour news now, and you can get all those headlines all day long, but actually to be bombarded with things about coronavirus and some of the incredibly unhappy, very sad stories that we're hearing is not good for our mental health. Important that you are kept informed and that you know what the guidelines are and that you're behaving appropriately. But I would advise just restricting your news coverage to perhaps once a day. Pick a particular channel and time that you like and just dip in once a day, but don't keep looking at the news about coronavirus. If you have physical health issues, chronic pain, I know, can really drag people down. And I know a lot of people have been at home not wanting to bother their doctor, but it is important that we look after your physical and mental health. So, if you're in pain, you must speak to your GP. They will be able to prescribe for you. They may not need to see you, but important that we deal with pain if we're going to deal with mental health. I think also there are a lot of people worried about their work. I'm seeing and hearing from people quite regularly who are currently furloughed, not sure whether they will have a job to go back to, not sure what the workplace is going to look like going forward. And I think uncertainty can be very angst-provoking for a lot of people. What I would say is try to keep in touch with your work. They may not have all the answers at the back of the book, but they may be able to reassure you about the sort of plans that they have in place. We've heard of an extension of the furlough scheme from the government, so maybe they may be able to reassure you that your job is perhaps more secure than you're worrying about. But trying to, rather than ostriching, actually keep the channels of communication going with your work, and they will hopefully be able to reassure you and keep you updated on what the plans will be. And of course we will be gradually, we hope, the government are going to be very closely monitoring what's going on now that in England we've had this slight relaxation of restrictions, and provided that we don't see more cases starting to increase, then we will gradually get back to some kind of new normal. But how do you know if you're just down or a little bit worried or if actually this is becoming something much more significant. I think probably every single person in the country has had some anxiety through the coronavirus pandemic, and I'm sure that everybody has had days when they feel a bit blue and a bit miserable. That's normal. We're going through a completely unprecedented thing with this pandemic. What's not normal is for dark thoughts to be constantly pervading your mind, to have no motivation, to feel that you've got nothing really to look forward to feel tearful a lot of the time, or to feel anxious all the time. You know, it's understandable. If you were getting onto a crowded train, you might feel anxious, but if you're at home feeling anxious all the time, then that's starting to get in the way of your normal day. And for me, that is the key. If your symptoms of negativity, if you're feeling down, if you're feeling low, depressed, if those are pervading your life such that they are having a negative impact on your quality of life or your ability to get things done, then you need to be talking to your doctor. I know a lot of you don't want to worry us, but we want to hear from you. And it's much easier for us to deal with things early on than it is if we let things just get worse and worse and worse. So we want to hear from you. I know a lot of people very against any kind of antidepressant medication, but it isn't medicine or nothing. There are lots of other things that we have access to. Your GP will know about all the local services. Things like CBT, cognitive behavioural therapy, can be really effective for particularly mild to moderate depression and anxiety. And so your GP will be able to advise you on that, and it's really important that you open up and talk to us. If you're frightened about doing that, if you're anxious, perhaps ask a friend to phone the doctor for you, or if you're actually going into surgery, take a friend with you. I actually really like it when patients bring somebody in with them, and I'll tell you why. It's a slight English thing. We so often will wait for an appointment to deal with something that's really impacting us in quite a significant way, and then somehow in the appointment we become a little bit stoical and a bit brave. And actually I usually find that when the friend or relative is in the surgery with the patient, it will be them that will quite often say, now come on, you're not being strictly honest here, it's a lot worse than you're making out. And that's really useful to me. Also, we know that we only retain about 20% of the information we're given in any appointment. Now, of course, if you've got somebody with you, they can make notes, or they may at least remember a different 20%. And so they can reassure you again, having heard what the doctor said. So when should you see your GP? We want to hear from you if your mental health is affecting your quality of life. It's as simple as that. None of us are going to be positive and feeling great and energised every single day of every single week, of every single month, of every single year. It doesn't work like that. We all have down days. But occasional down days is one thing. Down days that go on day after day after day need to be told, need to see a doctor, need to talk to a doctor, talk to family, talk to friends, reach out. There are some fantastic mental health charities. Samaritans have been doing amazing work through this pandemic. mind.org.uk are a lovely charity, really do some wonderful stuff for people struggling with mental health issues. So I think my overwhelming message to you, you maybe have had mental health issues in the past and this pandemic has just brought them to the surface again. Or maybe you've never struggled with mental health problems before and now this is something new that seems to be coming into your life. Either way, The important thing is that you seek help, and that we kind of help you turn that corner. We don't know when we are going to get out of this pandemic. We don't know when we'll get back to normal or what the new normal will be. But I do know that your doctor can and will help you if you're struggling. So please pick up that telephone if you need help. And if you'd like me to talk about other issues, or if you have questions for me, please do message me. I will be back very, very soon. But until then, please stay safe and stay well.